Coming up on Why Should I Trust You? There's a battle brewing right now over how to tackle America's health problems. Is your illness more about infectious disease or your underlying chronic condition? The first battleground, the West Texas measles outbreak, the first major public health challenge under RFK Jr.'s watch. One side says vaccination is the best and only way to prevent measles, while the other is touting the benefits of diet, nutrition, and vitamin A. We're talking about cod liver oil. But maybe it's deeper? Is this outbreak revealing a split over germ theory itself? Mainstream science sees germs as the driver of sickness, while the other side believes it's a person's underlying health conditions, determined by their immune health and nutrition levels. So is this how it's going to be from now on? Whenever we're faced with a health crisis, we're going to get two conflicting sets of signals on how to keep ourselves safe? On today's episode, we talk with Marion Nestle, America's foremost nutritionist and a leading public health voice in the country. Let's get started. Hello, everyone.
We are here.
Hey. We are here. I'm Brenda Adhikari.
I'm Maggie Bartlett.
I'm Dr. Mark.
I'm Tom Johnson. Maggie is a virologist. Mark's a doctor. Brenda and I are journalists.
Yep.
How's everybody doing?
Yo, it's good, man. I've been thinking a little bit, not to jump right into it.
I'll jump right into it.
Should we just jump?
We have a lot to do.
We have a lot to do. So look, we've been talking about measles. We've been talking about just this outbreak. And I don't know if you guys saw, the Children's Health Defense, which is the group that RFK Jr. used to work for or head up. It's a group that I think for a lot of people, they are associated with being pretty anti-vax, but they say dedicated themselves to sort of fighting for children's health. So they featured the two parents of the little girl who died from measles in Texas. And I watched the interview. Did any of you guys watch it? Tom, I think you may have seen it, right?
Yeah, I did.
I saw small clips.
Yeah.
Same.
So it's
rough.
heartbreaking. No matter where you ultimately, fall on how you feel about the measles vaccine or whatever, watching parents who've just lost their child is just heartbreaking. It is devastating. And you just hear their story and you feel for them,
Yeah.
Any death of a child is harrowing, and especially from infectious diseases, it feels really unacceptable.
Well, so that was what was interesting, Maggie, is because, I think to this couple, to these parents, I don't think they view her death as from infectious disease. From the interview, it sounds like they view her death as a result of neglect at the hospital. Like they believe that she was not properly treated at the hospital, that she wasn't given the right treatments, from breathing equipment to vitamin C to vitamin A. And again, I don't know exactly what went down at this hospital, but the bigger thing is that they really don't think she died of measles. And the other thing I thought was interesting is that the entire family then got the measles right after, by the way, at the little girl's funeral, the mother had measles, and, they said everybody recovered. And so for them, I think what was really interesting is, even with the death of their little girl, it still underscores just a really different worldview about disease and illness and the way you kind of handle health.
Yeah, I mean, they're Mennonites, first of all. And, just listening to them, it was obvious that going to the hospital and suddenly having their child moved to the ICU was a really disorienting, it would be for any parent, obviously, but they just found the whole thing very disorienting. Things were happening quickly. I'm not 100% sure they seemed like they understood what was occurring. And, the end of the conversation, they were asked, what's your message to other families right now? Would you recommend that they get vaccinated for measles? And they answered no. We absolutely would not take the MMR vaccine. And, their message through the translator was, don't do the shots. The measles is not as bad as they're making it out to be.
Tragically, the little girl died of, sounds like, complications from measles, right? So she had measles, and then there are things that happen. We've talked about it before on the pod, but brain swelling, pneumonia, dehydration are the most common causes. And it sounds like she had some pneumonia issues. And I think the takeaway now is that this child's life mattered. And it mattered to lots of people in different ways. And I think that's you just can't ever imagine being in that situation. And it to be in a hospital with alarms and bells and going off constantly is dizzying, is overwhelming. And they weren't prepared for that, as no parent should be prepared for
Right.
that. And it's just, this happened before with measles. It's not the measles that takes you, it's what happens after you get measles. And it's why a lot of children, died before, because they don't trust the parents don't necessarily trust just the healthcare system in general. So even if it's dehydration, they don't even want the IV fluid. So it really is about how you're looking at this. And these parents are, just right now, not even in a state probably to really process all that happened.
Yeah.
Boy, Mark, that is just so well put. And they're so young. I couldn't help but notice that they're a really young couple with just a beautiful family that is now in mourning. And I think the other thing that caught them by surprise is how they've now been thrust into the limelight in this very political conversation in this country about vaccinations, about beliefs. And so us as a team, when we were talking about this, we were like, look, it's like there's so many different things. Like this always happens, right? Whenever there's a controversial story, it just gets so muddled. Like there's so many signals that are being pumped out. And it's like, I think for us, we try to kind of press pause on some of those and like untangle it, right? So I think what we sort of discovered is that like underlying this is a deep philosophical difference in how people even look at disease. And we're going to get into all that in just a minute, but maybe just to table set a little bit on where we're at. Mark, why don't you take us through just some of the quick bullet points on where we're at with measles right now?
Yeah, I mean, just to do this quickly because it's in the news, but there are at least 300 cases right now of measles across like 14 or 15 what they call jurisdictions, mostly in kids under, age 18. About 17% of them are hospitalized and nearly all of them are not vaccinated. I think what's most notable here is that this number 300, first of all, it's right now March. We'll get updates later today about newest numbers, but this is already in March more than we've had all of last year. So Texas is the epicenter of the outbreak. We'll get more updates there. And then the other thing is that all these numbers that we're counting, it's 301 to be exact, those are just confirmed. We already know that measles is so highly contagious. There are definitely way many more cases than 300.
Yeah.
These are just the ones that are confirmed with testing.
Right. We're not doing enough testing of additional people, family contacts, and things like that to get a true sense of the number. These are just, when we think about the number of people who are hospitalized, the severe cases. And so when people do think about things like mild to severe measles, that plays a factor. So we're really only seeing, just like at the beginning of the pandemic, we're seeing the severe cases first.
Yeah. So while dealing with this outbreak, America's new HHS Secretary, Robert F. Kennedy Jr., has been, hitting the airwaves and communicating to the nation. There's a lot of attention, obviously, around the subject. So there's a lot of eyes on him in this moment. And he has voiced support for people getting vaccinated, both to protect themselves and to protect their immunocompromised neighbors. He quickly adds other context to his endorsement of that. He says that he really believes it's an individual's choice. No one should be forced to get vaccinated. And he has been talking up in some of these interviews what he sees as the risks from this vaccine, which, we will note the risks have been well studied, well documented. And this is, I think, by all measures, a very safe vaccine and a very effective vaccine. But anyway, here we want to play this first clip. This is him on Fox News recently. And in it, he's talking about the power of vitamin A, and he's sharing what he's hearing from doctors on the ground in Texas and some incredible recoveries that are resulting from vitamin A and some other interventions. Let's listen.
They report budesonide, which is a steroid. It's a 30-year-old steroid, and clarithromycin, and also cod liver oil, which has high high concentrations of vitamin A and vitamin D, and they're seeing what they describe as almost miraculous and instantaneous recovery from that. We don't make it at HHS because we haven't done a clinical trial on those, and we should have, but we haven't, and we're going to. We need to look at those therapies and other therapies. We need to really do a good job talking to the frontline doctors and see what is working on the ground, because those, therapeutics have really been ignored by the agency for a long, long time.
Yeah, so there's RFK stating that the doctors on the ground are seeing miraculous recovery from these interventions, including cod liver oil. So obviously a lot to unpack here.
Yeah. It is a really curious shift in the narrative during a dangerous outbreak, right? Moving from how do you prevent it to quickly, how do you treat it? Now, first of all, he mentions budesonide. That is not an effective or proven treatment for measles. It's a steroid, which actually lowers your immune system. So that's the opposite of what you want to do if you have an active measles infections. I mean, it can be used, when we use steroids in COVID and things. If your lungs are overwhelmed with inflammation, which can sometimes happen from complications like pneumonia that we just, we're talking about, think asthma, so much inflammation. So you give a steroid to lower it. But this is late in the game. And remember, measles does cause that secondary bacterial pneumonias, and they can clog up the airways. So you do give it. But as any doctor knows who gives steroids, it's a double-edged sword all the time. You give a steroid because you absolutely must do something to clear that airway to allow somebody to breathe, even though you know that steroid is going to weaken the body's ability to fight off the infection. So this is really, really an end resort. He mentions clarithromycin. That's an antibiotic to give for complications from bacterial pneumonia. So, vitamin A is a studied treatment for measles, and it is a great discussion to have, and we're going to get into that a little bit later. But, what's interesting in all of these comments, particularly with RFK Jr., is that he's been really effective. As we just heard him, he's sitting across from a Fox News senior medical analyst and doctor, and he's shifting the conversation away from vaccines and towards treatments. And that happened during COVID. We heard that narrative before. But instead of being clear about what causes measles, again, this germ theory, it's a virus that causes it, he wants to talk and have people ask, why aren't we spending more time and resources on treating measles? Why don't we get our bodies ready for the fight with nutrition? And so, this message is resonating. I mean, we talked about this Mennonite community. It's hit them especially hard. And, just to be clear, Mennonites don't universally reject vaccines. They aren't really, in this community in particular, vaccinating at high enough rates to prevent measles. And, I think on this podcast, we've heard people say that, people don't easily get influenced. But if you listen to the pastor of the Mennonite church in this hard-hit community, he wants to, in the middle of this outbreak, he's taking a hands-off approach. I mean, just earlier this month, he said, quote, "With this measles situation, I can honestly just tell you, we haven't taken any steps as a church." He said, "We did leave it up to the mothers." And he defers to RFK Jr. on the matter. He says, quote, "Do I trust the vaccines? No." And I get from Kennedy, he says, that he doesn't trust all the vaccines either. And he is very well educated in that. I am not.
And just to add to that, Mark, there's been some reporting that this is a community that has said that they have several vaccine injured kids among them, and that they've even asked RFK Jr. to ask the CDC to come and speak to those families. That, while you're absolutely right that, we can't speak for communities at large, but this particular one has a very, or claims to have a very specific relationship with vaccines, and it's not a positive one. So that's something to look into as well. Tom, you had mentioned to us about this Times article that you wanted us to look at. I don't know if I did my homework. Tell me what was in it.
Yeah. So over the weekend, the New York Times published a piece that found that some seriously ill kids in Texas had been given alternative remedies like the cod liver oil that we're talking about, rather than being brought to the hospital. And the Lubbock director of public health said, quote, "If they're so sick and have low oxygen levels, they should have been in the hospital a day or two earlier." So kind of in short, from this reporting, the concern there among some public health officials is that in this middle of this fast moving measles outbreak, residents might be delaying bringing their kids into the hospital and instead opting to try these remedies, such as the ones that RFK is endorsing, like vitamin A via cod liver oil. And perhaps that's not working, and kids are coming to the hospital a day or so later than they'd like them to be brought in.
Yeah. I mean, this can be fast moving. I mean, we all kind of sit at home and you wonder, is it time to go to the hospital or not? I'm having chest pain, or my kid's sick, they can't breathe. When do you go? It is a difficult choice to make. And I think what people don't realize is that once this like inflammation cascade gets going in the body, things can get out of hand and out of control really quickly. And that's really hard to see, especially if you aren't paying attention to, solid medical guidance.
Can I just say something about the Mennonites? Because it just seems to occur to me after watching that interview. I really hope it's not the case that this community suddenly becomes like this pawn in this bigger war that's playing out here, where both sides are sort of trying to use the death of this child as proof. Should have been vaccinated, or proof these people, they're living through it and they still say don't vaccinate. It's just in our media ecosystem today. Like it seems like it's already happening. And it's sort of another casualty.
I couldn't agree with you more, Tom, that, these stories get weaponized very quickly for people's political convenience. And that is hurtful and painful. And Maggie, I know you've looked a lot at this vitamin A, just with vitamin A and measles. Just help us unpack that a little bit.
So here's the deal with vitamin A and measles. Studies have found that it's useful for treating measles patients who are malnourished, and it can reduce death in vitamin deficient children. But we're talking about children in certain regions, particularly certain regions in Africa or low and middle income countries where populations are malnourished. That's why the World Health Organization recommends it as part of the treatment protocol. But here in the United States, it's estimated that only 0.3% of our population is vitamin A deficient. And so the studies that have been done on populations like ours show that it can reduce severity of measles and lower the risk of complications in individuals who are deficient, but really has no effect on those who aren't deficient in vitamin A. So that's the majority of people in America.
Yeah, I mean, Maggie, it's almost like, RFK Jr., he's not completely out in left field by endorsing vitamin A. I mean, if anything, this is like reset the conversation. You got to remember, doctors in this country have not been treating measles. We don't see measles. So measles is a state or a condition that can deplete your vitamin A. So even if you came in with normal vitamin A levels, you could plummet. I mean, like I said, he's not out in left field. The National Foundation for Infectious Diseases, I mean, this is a top professional organization of ID doctors. Back in 2020, they put a report out. It was called Call to Action, Vitamin A for Measles Management in the United States. And in that report, they say, quote, again, this is not Africa, this is here. After carefully considering the risks and benefits, the participants basically agreed that the U.S. recommendations should include the following. Vitamin A should be prescribed for pediatric patients in the U.S. with a confirmed measles diagnosis. They're not talking about nutrition status. Every child. So just to be super clear, again, measles is the most contagious virus, but vitamins do not prevent measles. Unvaccinated people who take vitamin A can still easily get measles. It's an airborne disease, has nothing to do with, your vitamin A status necessarily.
But Mark, I think they would say, even if you get it, it won't be as bad. And now, is there any truth to that?
If you get what, it won't be as bad. If
you get measles and you are sort of like, you have vitamin A, you have these treatments for measles, it won't be as bad. I think that's what I'm hearing them say.
Not only it won't be as bad, I mean, it will prevent you from dying. I mean, again,
no, not the vaccination, the vitamin.
I'm talking about vitamin A.
Okay.
Yes. And if you are a malnourished child or you have low vitamin A levels, giving vitamin A can save your life. And it's a drastic reduction, like 60 to 80% chance less of dying if you take vitamin A. I think it's worth taking a beat for everybody to realize we are probably all on the same page here. Everybody wants you to have healthy vitamin A levels for a variety of reasons, but in measles particularly. I mean, according to the World Health Organization, the vaccine is still going to prevent measles deaths, and they predict 60 million measles deaths were prevented by the measles vaccine in the last nearly 20 years. So we want vaccine protection, and we'll still give you vitamin A.
Yeah. And so we know that RFK Jr. has stated repeatedly that America's top health priority is fighting chronic disease, not infectious disease. And that fight requires America to eat more nutritious foods and end our over-reliance on pharmaceuticals. That's his message, and that's his message during an outbreak. So I just want to play a clip of him. Here he is on Fox again.
You pointed out there is malnutrition in West Texas and Gaines County and in the Mennonite community. The doctors that I'm talking to on the ground, the leaders of the community, are reporting that the people who are getting sick are people who are, and the little girl who died, where malnutrition may have been an issue in her death. So there's a lot of poverty in that area. The food, it's kind of a food desert. The best thing that Americans can do is to keep themselves healthy. It's very, very difficult. It's for measles to kill a healthy person.
Let's dig into this a bit. RFK said that the little girl in Texas who died of measles, he said that malnutrition may have been an issue in her death. And that just straight up contradicts what the Texas Health Department is stating on their website, which is, quote, the child was not vaccinated and had no known underlying conditions.
I mean, just look at the death rates around the world. Who's dying from measles? It's kids less than 5. They're healthy.
Right.
I mean, all of this can be true. You can be perfectly healthy. You can have high vitamin A levels. You can play outside, scrape your knee, run, be on the swing set, and you can still die from measles. And, nobody's going to argue that good nutrition and exercise aren't going to help you. But, you do need to realize that there's no substitute for a vaccine in preventing an airborne disease. And the idea that it's very difficult for a healthy person to die from measles, it's just not true. And then you tie into this idea that he's, getting rid of a large number of employees at the government, and that we are focusing on, infectious disease and at the NIH and funding of our societies. I mean, that's also just not true. I mean, there are lots and lots of centers in our government agencies that tackle chronic disease. I mean, you have diabetes translation, heart disease and stroke prevention, the division of nutrition. I mean, there's a division of cancer prevention, office of smoking. I mean, kidney disease, heart and lung disease. I mean, there's a long, long list. And a lot of those people may not have jobs right now. And the government is equipped to do both.
Caitlin Gentilina, another friend of the podcast, who, if you don't know her work, on top of all that she does in the name of science, she also is big in science communication, and she writes your local epidemiologist Substack, which is
fantastic.
Excellent. It's fantastic.
Incredible.
And she titled a recent post there saying, "Why is RFK promoting vitamin A and not really driving vaccination?" And she says, RFK Jr.'s embrace of vitamin A and a suggestion that poor diet and exercise are to blame for measles complications are no surprise. His views align with a more subtle form of germ theory denialism, which he outlined in a recent book and has gained traction in popular culture. So she kind of really takes it to the next level. And she goes on to write, quote, this perspective doesn't deny the existence of germs outright, but argues that people only become vulnerable to infectious diseases when their immune systems are weakened by poor nutrition or environmental toxins. But
Yeah,
also trying to make the argument that there's another way to do this. There's another way to protect yourself from a virus, and that is just by making yourself more healthy.
Yeah.
Eating a better diet, exercising, and that's a way of not vaccinating. You can see how these are sort of the underpinnings of that case.
But see, this is something that I like. If I could be an advisor, right, to the Make America Healthy Again coalition, if I could be an advisor to RFK Jr., here's what I would say. Mr. Kennedy, you have a lot of momentum in this country right now around this country genuinely wanting to get healthy again, because you have successfully built this platform. You brought a lot of people into the tent. You got them to vote for Donald Trump. Now you are in power. Clearly, there are people excited about your message. The vaccine component of this message is totally throwing them off. It is making the Republican Party, in my estimation, a little like scrambled in their heads for what to do with something that's generally popular in this country. You saw that Dave Weldon is no longer going to be confirmed or go through confirmation hearings to be the CDC head. And part of the reporting is like they can't have another person who's like anti-vax inside of the Trump administration. I feel like, I know that the vaccine thing is so important to parts of this movement, but if the bigger part is to get America healthy again for the chronic disease component and to get toxins out of the food system, like, can we start there? And can we not just get super into this very, like, it's like this third rail conflict that when we talk about it, it just, everything stops in its tracks. So I don't know. That's my little thing that, like, you can get what you want. Why are we putting everything into the vaccines bucket?
I think it's because it speaks to the MAHA movement's fuel is in large part challenging the status quo. And what better way to challenge status quo than vaccines? It's, you can
challenge status quo with the food companies. You can challenge it with the pharmaceutical companies in terms of all this other stuff. Like, no, I totally hear you. It completely fires them up. But I'm just speaking purely from a tactical perspective that, like, if it's about making America healthy again and changing our food supply and reducing chronic disease, we don't even need to talk about vaccines in order to do that right now. Like, that doesn't need to be a part of the conversation. And why is it such a huge part of this conversation?
I think Robert F. Kennedy Jr. has a small morsel of him that honestly knows that this is true, because even when he takes down miasma theory versus germ theory in his book, he concludes with maybe a sentence that he doesn't want everybody to read, but he writes that the two approaches have a path. He says, "It seems to me that a mutually respectful, science-based, evidence-based marriage incorporating the best of these two clashing dogmas would best serve public health and humankind." Those are his words. After he does a takedown of miasma versus germ theory, he ends with, "We have to do both." And I think everybody's going to be watching him to see if he really can rally both sides to get this done.
Boom.
Yeah. I mean, I think I hear you, Brenda, on the tactic of what you would advise him, but I imagine he would say right back to you, Brenda, but I believe these vaccines are dangerous and I can't in good conscience go out there and promote them. Like, he seemed so uncomfortable in the Sean Hannity interview where he said people should get vaccinated. It is the best way to protect yourself and your neighbors. And you could even see Hannity jumped on that and said, "I want everybody to hear what you just said. You're saying get vaccinated." And he's like, "Yes." And then, the bigger conversation though that he has is, these things there's a real danger here. And every year people die from these vaccines and people get injured and we don't even know the beginning of all the injuries. So I just don't know if he believes in the vaccine enough to take your advice.
No, look, yeah. I hear you, but ultimately he works for Donald Trump, and Donald Trump, as far as I understand it, does not appear to be an anti-vax president. Now, one might say a lot of stuff about him, but he is not, like, that's not his platform. He's joined forces with someone who has been very vaccine skeptical. I think I remember Batya was on this podcast and she says, he's probably signing off on just these studies that are going to look into things, which absolutely erodes trust in vaccines and things like that. But ultimately, he's not going to want a measles outbreak on his watch. Mm-hmm. Like that doesn't look good for MAGA. Well, he's probably not going to want it to get bigger than this, which is why you have somebody like RFK Jr. going out there having to very reluctantly throw his support for vaccines, write op-eds, go on to Hannity where he's talking about vaccines. This is more than he's done ever. So look,
but it's also why he's trying to change the narrative. It's also why he's really pushing you to talk about vitamins.
He's trying to have it both ways. And I think ultimately, I don't know if that's going to work, is all I'm saying. Okay, well, it's time to bring in a giant in the field of food, nutrition, and public health. She is a professor at New York University, NYU, the author of more than a dozen books. She's been called America's preeminent nutritionist, widely credited with establishing the field of modern American food studies, and she's no doubt one of the most influential voices on the subject. And finally, she holds more honors and has won more awards than we can count. Literally, we lost count. So please welcome Dr. Marion
Yay.
Nestle.
Welcome.
Yes, welcome.
It's wonderful to have you, Marion. So look, we have been talking about this kind of philosophical tension between infectious disease and chronic disease. And I guess I wanted you to kind of be the referee in this like throwdown, which is, you know, when we're in the middle of a measles outbreak, you've got one side that says if our country was just healthier as a baseline, they wouldn't suffer as much. And then you've got another side saying it doesn't matter how healthy you are, diseases are going to screw you over and you got to be protected. Like, where do you kind of fall in this and how do you make sense of this?
Those things are true. They're absolutely true. If you're healthier, you won't suffer as much from disease. But even if you're healthy, infectious diseases have a way of penetrating health, and you're not protected. It's so interesting to me because we think in the United States that infectious diseases are diseases of the past. The COVID pandemic came as a big shock. We weren't expecting anything like that. And we certainly weren't expecting an infectious disease that would do the extent of damage that the COVID pandemic did, not only in just shocking loss of life and disability of people who have long COVID and other kinds of problems like that, but in what it did to society. I mean, we haven't had any experience with that. You know, even if you're old like me, you don't remember. I mean, you remember polio. I remember polio and things like that, but we haven't seen that in 70 years. So for anybody under the age of 70, you never experienced that kind of thing. And there was a huge transition after the Second World War from diseases that were caused by malnutrition, undernutrition, and infectious diseases, which were terrible to people who were malnourished, the transition to chronic disease, which are diseases of affluence. Eating too much, basically, and eating too much of the wrong kinds of foods. And that transition has been very difficult for the country to manage because preventing chronic disease means making people healthy. And now we're in Make America Healthy Again, and I cheer it on. I think it's a terrific idea. Let's do it.
Yeah, and we definitely want to talk to you about that. But just sticking with this theme for just another beat. I mean, it's true that someone who has follows a nutritious diet, who exercises vigorously, takes care of themselves, they can die from an infectious disease, correct?
Oh, absolutely.
Right. So
Nasty, those things.
what do you hear in this then when someone like RFK says it's next to impossible if you are healthy and have a nutrient-dense diet and exercise, it's next to impossible for you to die of one of these diseases. What is this that he seems to be putting on nutrition and keeping a nutritious diet?
Well, I worry about RFK. You know, I like a lot of what he says, and he sounds like me a lot of. But I worry that he doesn't know what he doesn't know. And that worries me a lot. That's a very dangerous position to be in. And I'm impressed that he reveals lack of knowledge of things that are quite surprising. There's a recent video in which he is reading food additive ingredients and he stumbles over riboflavin, which is vitamin. I think the Secretary of Health and Human Services somehow should have run across that piece of information somewhere. I was concerned that in his nomination hearings, he seemed not to know the difference between what the Department of Health and Human Services did and what the Agriculture Department did, or what was in the Environmental Protection Agency's purview. He didn't seem to know the difference, and also didn't seem to care about the difference. And that's a worry. And so my stance on what to do about him is I'm going to support what he says that I support, and I'm going to oppose what he says that I oppose. And I don't think that, I mean, I think it would be great if Americans were healthier, but they would be healthier if they were eating less, not if they were taking more vitamins.
Marion, I really appreciate that perspective. And maybe you could speak a little bit about what the general American should know about nutrition and protecting themselves in this context.
Well, nutrition is so easy that the journalist Michael Pollan can do it in 7 words. Eat food, not too much, mostly plants. Okay, really, that covers it.
I didn't hear you say Doritos.
M&Ms.
I did.
Yeah.
I did not.
We're going to ask you about what your favorite junk food is at the end of this, but continue.
It's ice cream. I'll tell you right now. I'm on public record as saying love ice cream. Eat food, not too much, mostly plants. You have to define food as relatively unprocessed, either minimally processed, unprocessed, but not what we're now calling ultra processed. But otherwise it's covered. And one of the basic tenets of nutrition always has been, it's never changed, eat a wide variety of foods, meaning eat a wide variety of relatively unprocessed or unprocessed foods or minimally processed foods, because each food has a unique combination of required nutrients. And if you mix and match your foods, you're going to get them all and you don't have to worry about it. And the people who need to worry about vitamin deficiencies are people who are sick and they're not eating enough, or they have digestive difficulties and aren't absorbing enough, or they have diets with huge areas of the food supply restricted, where they're not eating some enormous section of the food supply so that their variety is limited, but everybody else is fine. We're not seeing undernutrition, malnutrition, that kind of malnutrition in this country, except in hospitals.
Except we're talking about it a lot. I mean, is measles, the measles outbreak, the right time to be talking about vitamins, vitamin A? Like, is now a good time?
We don't have a choice about it. It's being talked about. Therefore, we have to deal with it. And if I say things like vitamin deficiencies are not a problem in America, I get yelled at. What about the dietary guidelines talking about nutrients of concern? Well, nutrients of concern is not the same as malnutrition, classic protein calorie malnutrition, which is also a disease of vitamin deficiency. We're not talking about, we don't have scurvy in this country. We don't have pellagra. We don't have these things because the food supply is so heavily fortified, and there are vitamins in absolutely everything, that it's just really not a problem. And for RFK Jr. to argue that measles is a vitamin deficiency disease, I think is not borne out by the data.
Marion, let me zoom out for a second and kind of channel what I'm hearing from folks who really support RFK Jr.'s argument and just the Make America Healthy Again movement more broadly, which is, I think we can all agree that America does have a chronic health crisis between, its obesity levels, its heart disease rates, and I'm sure a slew of other things, but those are the 2 things that I keep, hearing about.
Type 2 diabetes, let's throw that one in too. Let's
throw in type 2 diabetes. So when you're dealing with a population that is so sick, really, we're like, if you just go by those 3 metrics alone, we're a sick country. Is there truth to the fact that it's really hard to have a baseline approach in this country for health intervention when you're dealing with a population that is so sick? Yeah. Isn't it really crucial that the public health community is as rigorously committed to defeating chronic disease in this country in order for its infectious disease interventions to be really successful.
Absolutely. And there have been calls for the government to have an obesity prevention program for decades, but the government has never wanted to get into that, because if you're going to do something about obesity, you have to get people to eat less. And the bottom line is that eating less is very bad for business. And so no government agency has been willing to take on the food industry. And we could go back. I mean, the example that just leaps to mind is in 1979, the Federal Trade Commission attempted to put some limits on television marketing to children under the age of 14. And what happened was an explosion. The head of the FTC was fired, for starters, and Congress passed a law that said you cannot do anything to restrict marketing to children. That's the history of this. So it's not as if nobody had noticed that kids were gaining weight or that kids were eating junk food. It's that any attempt to do anything about it came up against business interests, especially after 1980 when Ronald Reagan was elected president. After that, all that stuff was off the table. And within the last few years, when the figure went up to 75% of American adults are overweight or obese, which means it's normal for people to be overweight, and it's a health problem. But if you want to do something to prevent obesity and the chronic diseases for which obesity is an enormous risk factor, you've got to get people to eat less, and nobody wants to do that.
Let's be critical for a moment of mainstream public health. They really do seize on, and rightly so, RFK Jr. and MAHA's aversion to vaccines, despite what they see as proof that these are safe and effective. Obviously, everything has a risk, every intervention. If you're being critical of mainstream public health right now, with the rise of MAHA saying we want to take on the chronic disease issue in this country, we want to tackle food and the food industry, we want to make America healthier again. What is your big criticism of mainstream public health and how they're handling this moment?
Doesn't care about food. It never has. Public health nutrition is a tiny, tiny, tiny piece of the American Public Health Association. And most of the American Public Health Association pays absolutely no attention to food at all. I have occasional editorials and occasional papers in the American Public Health Association's journal, but these are rare. If I look at the journal, I never see anything about food.
Are they condescending about this?
They're not interested.
Not interested.
They see it as, they see it as quotidian. It's very difficult to get professionals in other fields interested in food. Let me just give an example. When we started our food studies program at NYU in 1996, I had dinner with the provost, who was a theoretical mathematician. And he said, why would anybody want to study about food? And I'll tell you, I'm pretty good at this. I can talk about it's $1.5 trillion industry in the United States. There are 75% of American adults are overweight or obese. There are 15% of the United States population needs food assistance support because they're not getting enough to eat. I mean, I could go on and on and on. I could never convince him.
Do you think that Americans, with all this, enterprise of food and big business, do you think they have a choice in what they eat? Do we have a choice?
We have a choice of what's available. Do we determine that choice? No. We have a choice of products in supermarkets, of which the vast majority, if we had the same kind of labeling laws that Mexico has, would have warning labels on them. I was just in Mexico. Going to a supermarket is an astonishing experience. Most of the foods have warning labels on them about too much fat, sugar, salt, or calories.
Like cigarettes.
Like cigarettes.
Oh, yeah.
But great big black warning labels. And so we've been conditioned to believe that convenience is more important than anything else, that cheapness in food is more important than anything else. And these days, that's not a trivial issue because food prices have gone up enormously. And that we should have 22 different varieties of Cheerios, because otherwise, what would we eat? And in fact, the what would we eat question came up in the discussion of the dietary guidelines when they were being asked to consider whether to make a recommendation about ultra-processed foods, which they declined to do because one of the members of the committee said, if people don't eat ultra-processed foods, what would they eat?
I think that's a really helpful point to recenter on, Marion. Like, eating healthy and staying active are seen as these basic choices, but in reality, they're really a luxury that many people, especially right now, can't afford, whether it's food insecurity, lack of access, or time constraints. When we start to talk about Make America Healthy Again, vitamins and nutrition, I think it's really important to underscore that optimal health isn't just these personal choices, but the policy, the environment, and these systemic inequalities are shaping how we eat. Like, when I was a waitress and I was working 2 jobs, I didn't have time to source the best food or nutrition. I was living paycheck to paycheck, worrying about paying rent. And that's a boat that many people in America are living in. And so if you have to make these choices between, do you feed your whole family something that isn't as nutritious, or feed...
What they like.
Yeah.
It's very
What they
dystopian.
like, yeah.
So
Yeah, I mean, if we were going to design a policy that would promote America's being healthy again, this would mean converting the agricultural production system to produce food for people rather than feed for animals or ethanol for automobiles. Don't get me started on, roughly half the corn grown in America goes for ethanol.
And the other half goes for
Up
chips,
in,
right?
up in smoke, and the other half goes for, well, no.
Soda.
No, the other half goes for feeding animals, and we could talk about meat.
Right.
A very, very small percentage of the corn supply goes for corn chips or any other corn ingredient that people eat. It's not a system that's designed to produce food for people. It's a system that's designed to produce profits for the growers.
Are you saying that the support and the boost that we give to farmers is not for blueberries, strawberries?
Not at all. Not at all. Those are specialty crops in Department of Agriculture terms. The subsidies go to commodity crops. That's where the money is.
Marion, let me look, you've been doing this for a long time. This has been your, no pun intended, bread and butter, and you have been beating and sounding this drum about nutrition and policy and the food system. Now you've got Robert F. Kennedy Jr. in charge of the nation's health, and he has this movement called Make America Healthy Again. He should be the dream of somebody like you. His ultimate goal, or I just watched one of the ads he put up, is to end chronic disease in America and to remove toxins from the food system. I mean, that is a dream for somebody like you, right?
It absolutely is, and I applaud it wholeheartedly. What concerns me is that the first action that he's taken is to get artificial colors out of the food supply. I'm for getting artificial colors out of the food supply. I just don't think it's going to address chronic disease.
Huh.
Except
You
in
think that's the wrong solution
Just that
for?
it's low hanging fruit,
I
right?
think
That's
it's low hanging
right.
fruit.
Ah.
That's exactly the term I've been using.
Hmm.
It's low hanging fruit. It's the easiest thing in the world to do. The colors aren't necessary. They're artificial. They're cosmetic, and the companies are perfectly capable of replacing those colors with natural dyes, whatever
But it
those.
took us
It's
30
just
years, Marion.
yeah,
Well, because they didn't have to.
it's just ultra processed food still, but ultra
It's
processed food without red dye, and
without
the list of
without petroleum dyes. Yeah, they've won that one. Those colors are history. Okay, now let's see them do something about ultra processed foods.
I just need to take a time out. We are in the middle of a measles outbreak with literally people dying and a disease that's spreading unchecked in some parts of the country. And I feel like we're oddly in some sort of like plot twist or a TV show where look at the 4 or 5 of us here. We are now like deep in red dye 40, ultra processed food, and we've like been, redirected. I mean, is this
I'll add to that, Mark. One of the things that folks tweet a lot is, folks are freaking out about a couple of deaths from measles when you have X thousands of deaths from chronic disease every year, and why aren't people worried about that? Like, they're digging in even more into what they view as this false imbalance between concern over death.
Oh, I was so upset by that. I thought that was so wrong. You always, always, always in public health must put the victims first. You must. And the idea that a child would die for lack of a vaccination is heartbreaking. I mean, these vaccinations were welcomed by people who had losses in their families that were just tragic. So yes, and when I put that next to color additives in cereals, I think, okay, let's get rid of color additives in cereals, but let's not celebrate it until we've done something really meaningful. I want to see RFK Jr. and the MAHA movement take on ultra processed foods. That I want to see. And don't even get me started on the healthcare system.
another podcast,
Which is another thing. We don't have a healthcare system. So we have left this population, us, me, everybody, on our own in a situation in which we would be much better off if we had a government that did everything it could to make sure we were educated and healthy.
I want to pick up on something Mark said, which is, the conversation about the measles outbreak has changed, or is being changed, to one about nutrition. And there's a lot of anger, I think, over that changing conversation, that this is a moment to reinforce vaccines. A lot of critics we talk to of RFK who are in the public health community, they say you can't like cherry pick things about what he's doing or what he's saying or what MAHA's for, or what, you can't cherry pick. You just got to oppose. But you've been at this a long time, and
That seems unrealistic.
yeah. And you seem more opportunistic. Like, there's some serious things we have to fix about the way we eat, for starters. And you're seizing on, an opportunity, and therefore you are cherry picking. But like,
thrilled by the idea that this is being brought to public attention in a way that it has not been brought to public attention prior to this, except by Michelle Obama. And we do have to talk about the irony of that.
Well, tell me about that. Why do you think, other than, the answer is that I hear a lot from the left is there was just straight Republican opposition to it.
That's right. There was. And what's interesting to me is that, well, first of all, when President Trump announced his appointment of RFK Jr., he used the words food industrial complex.
Why did that make you laugh, Marion?
In his tweet, because it sounds just like me. what I would
You were
say.
MAHA before
Marion,
MAHA.
It's what
Donald Trump and Marion Nestle,
Yeah, how
twins.
about that? Politics makes strange bedfellows. When Michelle Obama did her Let's Move campaign, the first thing the Obama administration did was to appoint a task force to end childhood obesity within a generation. The first thing that Trump did was to appoint a MAHA task force to work on childhood health. Okay, it's 15 years later and it's Republicans doing it, not Michelle Obama, but I'm still bleeding from the painful opposition of Republicans to what Michelle Obama was trying to do. And I've always asked the question, when she picked school food as one of the places that she wanted to focus on, did she look at it as a bipartisan issue that everybody would get behind? Doesn't everybody want kids in school to eat healthy meals? Apparently not. Okay, so now the Republicans are doing it. Fine, let them do it. I want to see them do it. Do it.
Well, let me ask you something about that. And this is like a genuine question I have about this, because I also look at that Michelle Obama Let's Move program and I'm like, why the heck did that not work? Right. And okay, fine. So one answer is Republican opposition.
That is the answer.
Well, let me push you on one thing. The one thing I do see from Trump and MAGA and RFK Jr. and MAHA is a very open critique and attack of food companies and pharmaceutical companies.
Yeah, I'll believe it when I see it.
But is that, just help educate me. Did Michelle Obama do the same thing, that she was going to go after pharmaceutical companies and food companies?
Absolutely not. What she did do was try to induce food companies. She made a couple of really exquisite, eloquent speeches to food companies about how you have to stop marketing to kids. You got to stop marketing junk foods. I don't just mean this to be lip service. You got to do it. But she had no ability to force them to do it. And because she had a Congress that opposed everything that she was doing. So that she was, even though she was making these lovely, eloquent speeches that, were just glorious to listen to. And at first, the food companies were frightened by it. But then when it became clear she couldn't do anything about it, they, just ignored it. And I went to a meeting on food marketing at the White House during that period. And I remember hearing one of these amazing speeches. Couldn't have been better. You guys got to stop doing this, basically. And there was a food company executive in one of the breakout sessions afterwards. And he said, I wish our company could stop marketing to children, but our stockholders won't let us. That's what she was up against. And isn't Robert Kennedy Jr. going to be up against exactly the same thing?
I think that's really interesting because one of Trump's tactics is he's sort of bulldozing his way through tariffs and using these kind of what he believes are bargaining chips to get what he wants. And it'll be interesting to see if they try to do the same thing with food companies. I think you're right that it's going to be a little different. I mean,
this
look,
issue
here's
is not,
the thing. I want them to succeed because I think something needs to change. But I agree with you. When push comes to shove, I don't know how much are we actually willing to put corporations on the stand.
RFK Jr. has met with food company executives.
Yes.
There was a photograph that was published on Twitter and other places like that. It wasn't an open meeting, so we don't know what he said. So what came out of that meeting was the MAHA Moms video about color additives. Mm-hmm. Color additives are a distraction from what's really important, even though I'm on record. I want to get rid of the color additives. I don't like the color additives, but they're not ultra-processed foods. He has talked about ultra-processed foods. I want to see what he's going to do about it.
Marion, we really wanted to have you on today for many reasons, but one of the reasons is we sort of see you as cutting a third path here. There's the MAHA path on one side, there's let's call it the non-MAHA path on the other, and you're sort of cutting a path through the middle and saying there's good things on both sides of this fight. I think that is really a really interesting path, but I do think some of the folks listening today will have a hard time with that. Just talk to us a little bit about why both sides should trust that your path, pulling the good from each side, is the right path right now.
I'm laughing because I get asked all the time, nutrition is so confusing. Who should I trust?
Yeah.
And my answer to that has always been, well, me, of course.
Why should you trust Marion Nestle? Go.
Yeah, I don't know what to say about this. For me, it's absolutely thrilling to hear chronic disease in the public eye, the way chronic disease is in the public eye now. I've never heard this before. I've never heard it done in this way. I've never seen this MAHA moms movement, which has many good things about it. Let's have more of that kind of thing. I've never heard that before. It seems to me this is an enormous step forward and that we ought to run with it. But there's so little support in the public health community for food issues that I'm not sure the public health community gets what this is about. I'm not sure. I'm not sure because in the public health community and the health community in general tends to divide diseases up into silos. There's a heart disease, the American Heart Association. There's the American Diabetes Association. Every disease has its own advocacy organization and trade association associated with it. Nobody's looking at the big picture. And the big picture is that one diet deals with all of that. The same diet prevents all of that. The same health behaviors prevent all of those. And they should be looked at as a whole. And the MAHA movement is looking at it as a whole. Where it's going to go, I have no idea. I worry that Dr. Oz has been thrown into the mix. He's a supplement person. I worry about a lot of things. I want to see action on this. I want to see what he can do. So far, there have been two things done. They're both good. Get rid of color additives. Color additives are history, as far as I can tell. They're going to have to do that. And the other is to clean up the generally recognized as safe mess, which also deals with food additives. What it doesn't deal with is the other things that Kennedy has talked about, which I think are much more serious, which are the PCBs, the methylmercury, and the PFAS in the toxic chemicals that are in the food that are in the water supply. Right. That's not Kennedy's purview. That's the Environmental Protection Agency. And that, it seems to me, the really big issues are ultra-processed foods, having a food production system that focuses on food for people, not for animals or automobiles, and getting the toxins out of the water supply.
You're sounding like Kennedy now, Nestle. Marion, boy, do I wish we could just have you on for every episode because you're phenomenal.
You could be a co-host.
Yes, we're inviting you to be a co-host. Marion, thank you so much. Marion Nestle, nutritionist, professor at NYU, author of 1 billion books about nutrition. And we're going to have you back on. Let's keep watching this movement. And I think what I'm also hearing you say is that this movement can integrate priorities, even for folks who are really committed to reducing infectious disease in this country. Let's just see where it goes. So thank you so much for coming on board.
Thanks for inviting.
Thank you.
Thank you.
And that is our episode for today. Please send us any questions, comments. Marion had told us what her favorite junk food was. Why don't you send us your favorite junk food? I'm really into Pirate's Booty these days because my kids eat it a lot. I would like to say that I think it's healthy because I don't think there's any chemicals in it. Right, Marion? Pirate's Booty is healthy.
I roll my eyes.
Okay. We're just going to pretend she didn't say that. I'm Brenda Adhikari. He is Tom Johnson. He's Dr. Mark Abdul-Malik. She is Maggie Bartlett. We will see you right back here next week.